But Sharon, you started us off early in this conversation really mentioning or talking or pointing out the issue of systemic and structural racism, and Margo's taken us right back there. We only have a few minutes left, so I'm wondering if there are some final words that you, Sharon, then Anila, and then I'll kind of cycle back to you, Margo, but some final words that you want to say to this audience. And one person said, are there other tactics? You know, what else can we do collectively around some of those really big issues around systemic and structural racism? And I know that's a huge question. So Sharon, I'm going to start with
yes, you. All right. Before, let me try something. But before that, I do want to say, someone had mentioned in the chat about rural Nova Scotia having access to online resources being difficult. One of the things that we did at Hawk, and I personally did, was to apply for a grant from the Red Cross to actually provide people in rural Nova Scotia with tablets so they could access online mental health, culturally specific mental health resources. And we could also connect them to what was available, which isn't a lot, which gets to the question of structural racism. But what we have, we provided an opportunity through the Red Cross. And so I want people to be aware of that, because we know that internet access and access to electronic devices is difficult. With respect to structural racism, I think that, you know, just underscoring that it took a pandemic, unfortunately, to shine a light on many things. And the dual pandemic of anti-Black racism, particularly as a result of the dreadful treatment of George Floyd, and of course, so many others in the United States, but also in Canada and also around the world. There was, for the first time, it resonated with people across the world that Black lives matter to Black people, but also to other people. And as a I think a kind of switch that went on there, we are not going to let these learnings disappear, nor are we going to go back to pre-COVID times, to pre-Black Lives Matter time. We will be advocating, we will be clear in what we're asking for, and we will be relentless looking for equity and justice in policy and in decisions around all things. I also do need to say that this government right now in Nova Scotia is led by a premier who has among his key objectives addressing equity and racism. He has named that. There was just a restructuring of the Nova Scotia Public Service. For the first time in the history of Canada, we have 4 deputy ministers of African ancestry, female. We have associate deputy ministers who are Black females. This has never happened before. The commissioner of the Public Service Commission is a Black woman born in Nova Scotia. This is about structural change, and we aren't going back. We are going to continue to hold our leaders accountable. But I think that what I could say is recognize the reality, make sure that you do not, that you are not silent about what needs to happen going forward.
Thank you. Thanks for those powerful words. And so Anila, do you want some final words? And just before I go to Anila, what we found really helpful is if folks can actually put into that chat box one word right now, we'll end within about 5 minutes, but one word that's bubbling up in your mind, one word that you are thinking about, or that you're comfortable putting into that chat box. And you know, silence, Sharon, is, you know, or non-silence is what just was coming to my mind as I was listening to your powerful message there. Anila.
You know, I'm just so grateful to be here in this really esteemed panel, and to be able to hear from Margo and to hear from Sharon and all the wonderful work, you know, that's happening across the country. And I think that the one piece for me, the takeaway really that I really want to bring home, which we've been talking about, is that we all know that COVID has just exacerbated, or at least brought to the forefront, the issues in equity and you know, racism and that have been prevalent in our community and in Canada. You know, we're such polite Canadians that we often want to talk about other things, or we say, oh, well, you know, we're all working on it and whatever, but clearly we haven't been working on it, and we haven't been working on it as much as we need to. And I think that this is a really important way to, you know, to me, this is just the beginning. This is really, you know, cracked open a lot of the inequity, and the pieces that are so important to this are the pieces that we all know, but can often get lost in the jargon, and can get lost in the academia and all of these other pieces in the policy and the framework. And it's for us, by us. That's so important, right? You need to have people's voices included that are actually being you know, affected by policy and affected by that. You need to have those leaders in the community that can actually speak and can actually talk about those things, right? The number one thing that I say all the time when somebody has an aha moment about, you know, racism or discrimination is I say, welcome to my world. Since I was born, only in Canada was I born racialized. Had I been where my ancestors are from, that wouldn't have been a thing, right? And so I think that that's the most important piece, is that, you know, having voices together with allies working together. What COVID has shown us is that when there's a will in the community, the money flows. In one day, to get $1.6 million for a response because it affected the entire community, but happened to be in Northeast Calgary, shows me that there's money, that there's an ability, that there's ways to do things. And what we need to do as a collective is to insist that even outside of COVID or outside of a health crisis, that ability to work and navigate and to be flexible continues.
Thank you, Anila. That is some of the words that are coming up here are hopeful, and that is a really hopeful message when you actually see that kind of dramatic change or that dramatic response to community voice. So Margo, over to you just for a final word, and then we'll wrap up here. So Margo.
Wow. Never enough time in these conversations, right? I just want to hear more stories and how we can do this good work together. So on that note, I'm reminded, I really appreciate the notion of not only are we living in a pandemic reality of COVID-19, but we're also living in a pandemic of racism. And in the North, I know we're certainly living in a pandemic of opioids. And I cannot forget those young people that are suffering out there as well. That always is in my mind. I wish that there was a magic wand that we could raise to change all of this reality. But I want to say two things, and I'm going to hearken back to my own teachings now, my own Nihio teachings. And one of those is the whole concept of racism is a socially constructed concept that happened around the mid-1600s. Before that, we would have never been racialized in the way that we experience that today in this country and in other countries. It's not just here. And so I I've taken time and gone back to learn about that. And it's really about power, about privilege. It's all of those things. And so it's an extraordinarily complex phenomena that is deeply entrenched, in my opinion, in Canadian society. It's not our concept. And so then I think of the teachings of the elders that I have had the privilege of sitting at their feet to know, and they would say to me, Margo, all of us come with a job to do when we come here, when we're born and when we live here. Part of our job is to seek the balance and to live in peace and harmony. Our treaties were about peace and harmony. Our treaties were about sharing the land and living together in peace and harmony. And I think I look at myself and I say, this has been my time here. What have I done to strive towards peace and harmony? And so I ask myself that all the time. What am I doing to contribute to that peace and harmony? Because I think COVID-19 too shall pass, but racism is one that we're going to face for a very long time. And we need to know and we need to learn about that. So always those teachings sustain me when times are really hard. But that is our job. I believe that's all of our jobs, to figure out how we're going to do that. Which.
Thank you, Margo. I'm going to leave those as our final words. Thank you, Anila, and thank you, Sharon, for being with us today, for sharing your time, but also yourselves in this really, really important conversation. So thank you, everybody, and hopefully we'll see you again in 2 weeks. Thank you very much. I'm going to applaud as we go. Okay, bye, everybody. Thank you so much. Thank you.